Hello, welcome back. This is part 2 of the medical history. By the end of today's session, you will be able to list the elements of a past medical history, list the information to collect from a patient about the medications they are taking, and list the information to collect from a patient about allergies. Remember, you've already completed the identifying data, chief complaint, and history of present illness at this point. Remember a transition statement here. You might say something like, now that I've heard what brought you to the office today, I'd like to find out a bit more information about your health in the past. The past medical history has several components, the first being birth history and childhood illnesses. These are most important when you're interviewing a child. The other components of the past medical history include adult illnesses, past surgical history, accidents and injuries, psychiatric illness history, an OBGYN history, if the patient is female, health maintenance, and other providers the patient sees. When focusing on the birth history and childhood illnesses, this is obviously more relevant if the patient is young. You want to ask if there were any problems with the pregnancy or any exposures that your patient might have had in utero. You want to know if the patient was born full term and if there were any problems with delivery. In terms of childhood illnesses, you want to ask about common childhood diseases. Those could include things like measles, mumps, rubella, chickenpox, rheumatic fever, polio, and asthma, to name a few. You also want to know if there were any medical conditions that kept the patient out of school or put them in the hospital for more than a few days. The next segment is the adult illnesses. You should ask the patient if they've had any chronic illnesses or conditions. Common ones that you should review include diabetes, high blood pressure, strokes, heart disease, chronic infections such as HIV, and cancers. You want to know about any major illness that has now been resolved and any hospitalizations that the patient has had. You can then move to the surgical history. You want to find out if the surgery was done in the hospital or outpatient, and you want to know about when the surgery occurred, what was the indication for the surgery, and if they had any complications from the operation. You also want to inquire about emergency room or urgent care visits and ask about things like broken bones or stitches. Asking about other providers can be a useful way to broach the OBGYN or psychiatric history because it opens the door to those questions. I often start by asking if the patient sees any other healthcare providers. I'll specifically ask about an OBGYN, a dentist, and an ophthalmologist. Those are common providers patients typically see besides their primary care provider. The OBGYN history should be asked of all females. Usually start by asking about pregnancies. If the patient said yes, they're pregnant, you want to know about how many pregnancies they've had, what were the outcomes of those pregnancies, the age when they first became pregnant, the type of delivery they had, and any complications with pregnancy or delivery. The menstrual history should include the age of the first period, also called menarche. You should also ask about the regularity and any heavy bleeding that the patient has experienced. You want to ask if the patient has gone through menopause and if they have any symptoms of menopause at this point. You should also inquire about contraception or hormone replacement therapy, and you should ask about what type, why they were on these medications, for how long, and if they experienced any problems with them. Another important question to ask is whether or not they've had any abnormalities with their breasts or pelvic organs. And that could include something like abnormal breast exams, mammograms, any history of breast biopsies, abnormal pap smears, or any history of sexually transmitted infections. The psychiatric history can be obtained by asking if patients have had any problems with anxiety or depression or any other psychiatric conditions. You can ask if the patients ever felt the need to seek help or seek counseling. And if they say yes to these questions, explore that information a little bit more and ask about what they were diagnosed with and how they were treated, if they required hospitalization, and how they've been doing since the treatment. Health maintenance should include any screening tests and immunizations for the patient. This really depends on the age and risk factors of the patient. I've listed on the PowerPoint a few immunizations that you might want to ask about. There are a variety of screening tests we do, again, depending on the age and risk factors that the patient has. There's a very useful app that you should all download on your phone. If you want to get your phone out right now, you should do it. It's the AHRQ EPSS app. It's a free app, and it basically will allow you to plug in information about your patient, and it gives you the United States Preventative Task Force guidelines about screening for that patient. Medications are very important to get correct. A lot of people come in with medication lists, or they bring their medications with them, which is very helpful. Oftentimes, you will see when you actually see patients that the medications the patient is taking are not the medications you have on your list, so it's always really important to reconcile the two pieces of information that you have. You want to know the name of the medication. If a patient tells you a brand name, it's a good idea to look up what the generic name is. You want to know the dose, or how many milligrams, for instance, the patient is on. You want to know about the frequency that they take the medication. Is it once a day, twice a day? You want to know about the route of administration. So do they take it by mouth? Do they take a shot? Why do they take that medication? How long have they been on it? Have they had any recent changes in dosage? Any side effects or complications from the medication? And you always want to ask about over-the-counter medications, because they have a lot of interactions with other medications that patients aren't always aware of. So you want to ask about those, and vitamins, herbs, and supplements. Another important question is to ask if they take any medications that are prescribed for someone else. People don't usually volunteer that kind of information unless you ask them. And oftentimes people forget about things like eye drops, inhalers, and birth control, so sometimes it's a good idea to specifically ask about those. Allergies is the last part of what we're going to talk about today. You want to ask if a patient has any allergies to medications, the environment, seasonal allergies, allergies to animals or foods. You want to know about when they were diagnosed, what their reaction was, and how they treat their allergies. There's a difference between an allergy and an adverse reaction. So an adverse reaction is an unpleasant reaction that patients want to avoid. It's not usually a true allergy. An example would be, an opiate that I took for pain made me hallucinate, or the erythromycin I took for my strep throat gave me stomach cramps. Those aren't true allergies, and if you need to use that medication because it's the only medication that will work, sometimes it's still okay to prescribe those, and you might just need to manage sort of side effects with the patient. I'd like you guys now to watch this video. It's a continuation of the interview that I started with the history of present illness. It focuses on the past medical history, medications, and allergies. I want you to write down the past medical history, medications, and allergies as you would in a write-up. And I want you to compare your notes to the notes that I've supplied at the end of this video. Good luck. Peggy, now that I've heard a little bit more about what brought you here today, I just want to get a little bit more information about your past health.
Okay.
You tell me, when you were a kid, did you have any major illnesses?
Chicken pox.
Just the chicken pox?
Mm-hmm.
Any complications
No.
from that? No? Were you ever hospitalized as a kid?
Nope.
No? Okay. And what about as an adult? Have you been diagnosed with any medical problems?
The only thing I have is high blood pressure.
Okay. All right. When were you diagnosed with that?
10 years ago.
Okay.
Mm-hmm.
You were how old then?
45.
45 years old. Okay. So you're 55 now.
Mm-hmm.
Okay. Do you take any medicine for the high blood pressure?
I take Diavan.
Okay.
I take it once a day.
Okay.
And I believe it's 325 milligrams.
Okay. All right. Very good. And no other conditions that
No.
you've been... I have to run through a couple just because a lot of people forget there.
Okay.
High cholesterol at all?
Oh, yes, I do have high cholesterol.
Okay.
And I do take a medication, but I can't remember what the name of it is.
Okay. That's okay. I can call your pharmacy and find that out. Diabetes?
No.
Okay. Have you ever had a stroke?
No.
Any heart attacks?
No.
Any diagnoses of cancer?
No.
Okay. Very good. All right. And tell me, do you see any other doctors at all?
I just see the eye doctor
Okay.
and my dentist.
Okay.
Once a year. Once a year for my eyes, every 6 months for my teeth.
Okay. And do you see any OBGYNs?
No.
No? Okay. Your primary care doctor
Correct.
takes care of that?
Mm-hmm.
Okay. And while we're on that subject, can you tell me a little bit about your OBGYN history? When did you start having your periods?
My periods started, I was about 13.
Okay.
And I believe that my menopause started in my mid-40s.
Okay.
So,
All right. Do you have any problems with your periods ever? They were regular?
yes.
Okay.
Mhm.
And what about menopause? Did you have any problems at all? No.
No.
That's good. A lot of
Yeah.
people have
Yeah, no.
pretty uncomfortable symptoms of
Yeah,
that.
no.
Did you ever need to take any hormones?
Nope.
No? Okay. And tell me a little bit about pregnancies. Were you ever pregnant in the past?
I have 2 children.
Okay.
They were both normal pregnancies,
Mm-hmm.
vaginal births.
Okay.
Everything was fine.
Full term?
Full term.
Okay, very good. Did you have any problems with pregnancy, like gestational diabetes?
No.
Okay, very good. So you don't see an OBGYN. Were you ever treated for any sexually transmitted
No.
infections in the past? And have you ever had any problems with screening tests that the OBGYN would do, like breast exams or mammograms?
I do a mammogram once a year,
Okay, very good.
and I also do a colonoscopy once a year.
Okay, you do a colonoscopy every year?
No, every 5.
Every
I'm
5
sorry.
years.
Yeah,
Okay.
every 5.
Okay.
Stop and think.
That's okay. All right, when was your last colonoscopy?
I had both of them done in the fall.
Okay. All right, very good. And what about pap smear?
I had a pap smear done in the fall too, at the same time I had the mammogram done.
Okay. And any abnormals in the past?
No.
No? Okay, very good. What about immunizations?
I've had all of the ones that have been recommended that you get as an adult. I've had, pneumonia and flu and shingles, and plus the DPT, all those. I've had all those done.
Okay. All right, good. And I can check your chart for all
Yes.
the dates on
Mhm.
those too. Okay. In the past, have you ever needed to see any mental health providers?
No.
No? Okay. Have you ever been down or depressed?
No.
Never?
No.
Okay. Any problems with anxiety at all?
Nope.
No. So you've never treated for any psychiatric
No.
conditions?
No.
Okay. All right, good. So the only other providers you have are your eye doctor and your dentist. Okay. All right, very good. Have you had any accidents or injuries at
No.
all? Have you needed any surgeries? Never had any surgeries before?
No.
No? Okay. All right, very good. Good, let me just summarize, make sure I have everything. So you had only chickenpox as a kid without complications. You have high blood pressure and high cholesterol. You're treated for both of those. Let's see, you've had no surgeries, no accidents or injuries at all, no emergency room visits. You went through your period when you were 13 and menopause in your 40s. You've had no problems with that. You had 2 pregnancies, both healthy kids. You've never needed any treatment for depression or anxiety. And you're up to date with your immunizations and all of your screening tests,
Yep.
which is great. Okay. So I think now I'm just going to ask about your medications. You mentioned that you're on Divan. You said 320 milligrams or 325
5.
once a day. Okay. And you don't know the cholesterol medicine, but we can look that up.
Yep.
Are you on anything over the counter besides the Tylenol you mentioned?
I just take the turmeric
Okay.
over the counter
Okay.
because it's supposed to be a very broad
Mm-hmm.
medication that'll take care of, brain health and swelling and, just a general thing, so I take that.
Okay. Do you know the dose on that?
I take 1,000 milligrams, which are 2 500 milligram capsules once a day.
Okay. All right. Any other herbs or vitamins? No. Any supplements?
Nope.
Any kind?
Nope.
Okay. And do you have any allergies to anything?
I do have an allergy to penicillin.
Okay.
I took it once for some infection and I got a terrible rash.
Okay. All right.
That's it.
Any environmental, seasonal, food allergies?
No.
No?
No.
Okay. Good. So I think I've gotten a lot of information about your past health. So I think we'll move on to another section now.